It is February and it's Heart Health Month. And so, really, a time to talk about the leading cause of death in the US. Good thing is that, 80% of cases of cardiac death can be prevented, which is huge. We believe the Health Hero methodology where you can actually do something and take control of your health. So, even though cardiac disease can be a killer, we can do something to stop them. So, I often talk to my patients about heart health. I, in fact, talk to them all the time. Why? Because your heart really keeps your entire body going. It's powerful muscle that pumps blood all throughout your bodies and gives it the nutrition, the oxygen that it needs. And just like any other body part, however, it can wear down over time. Now, heart disease, super general term for conditions that can affect the heart and the blood vessels as well that supply the blood throughout your body. Now, heart disease can include arrhythmias, which are irregular rhythms of the heart, congenital heart defects. That's when babies and kids that are born have heart defects, and coronary artery disease. That's the plaques and the blockages, and that these all these diseases are in the general term for cardiac disease. So let's talk about coronary artery disease. And plaque made up of cholesterol builds up in the arteries, making them stiff and narrow, right? And this reduces the blood flow and can lead to serious problems like heart attacks. And we've all heard of heart attacks. They can be deadly. So what kinds of symptoms can you have with heart attacks and heart disease? The common signs are chest pain or tightness of the chest, shortness of breath, dizziness or weakness, irregular or fast heartbeat, the nausea or sweating, and pain or numbness in the arms or legs. So all these are typical symptoms. Doesn't mean you have to have all of them or some of them, but those are symptoms that we see often. So we're talking about heart disease and number one, cause of death in the U.S. What can we do? What steps can we take to prevent this and protect our hearts? I have 6 simple methodologies, simple ways you can really, take simple steps you can take to really protect your heart. So number one, know your numbers. High blood pressure and high cholesterol, major risk factors. In fact, nearly half of U.S. adults who have high blood pressure don't even know it. And seeing your doctor, getting the numbers for a checkup, really the best way to understand your risk. You may not have any symptoms, but if you could just, simple thing, get a blood pressure machine also, either at the doctor's office or your home, and you can check your blood pressure. Important to do blood tests to check for your cholesterol as well. So important. Number 2 is manage your stress, right? I mean, it's a stress, it's a pressure cooker out there for so many of us. And we know that stress is not great for you, right? We know it raises blood pressure and increases your risk of heart attacks or even other problems, including we know it can worsen your risk for stroke. So you got to find ways to be able to lower the stress. Consider deep breathing and meditation, yoga, even a short walk. I love meditation, but you may like yoga, deep breathing, whatever you can do to really reduce that stress. Also, eat smart. Remember, a heart healthy diet would focus on whole foods like fruits and vegetables, whole grains, lean proteins, healthy fats, not pepperoni pizza. Now, also cut back on processed foods, cut back on added sugars and excess sodium. Important to read the nutritional labels and cook more meals at home. We in the Nandi household often cook at home. We get the kids involved. It's healthier. We know what's going on in our food, and our kids love the whole process of cooking. And I believe it's really a huge part of spirituality and community when you cook together. Also, get moving. One of the 5 pillars for Health Heroes is movement, especially movement with purpose. And we feel, and now research has also shown that exercise is one of the best things you can do for your heart. And how much is enough? Aim for at least 150 minutes of movement per week. Now break it up however you want, right? It kind of all adds up. If you want to take the stairs, I take the stairs all the time. Try not to take the elevator as much as possible. Park farther away. Don't get right next to the door, or just go for a quick walk. Movement with purpose is really great. Play with your kids, walk your dog, whatever it is, so you can have purposeful movement along with getting the exercise. But a huge, huge factor of smoking. Please quit smoking. And I know it's difficult, but it's very important. Remember, smoking can damage your heart and your blood vessels. But the moment you quit, your heart starts to heal. Even if you've been smoking for years, the moment you quit, your heart will start to heal. If you need help quitting, talk to your doctor, your healthcare professional, and check out support programs. So very important there. And then what about alcohol? Please watch your alcohol intake. Too much alcohol can raise your blood pressure, raise your total cholesterol, putting extra strain in your heart. If you drink, do so in moderation. And what does that mean, right? So we feel up to 1 drink per day for women and up to 2 drinks a day for men. If you have to drink and you feel like you want to try to do it within moderation, that's it. 1 drink per day for women, up to 1 drink per day for women, and up to 2 for men. No matter what your age, right? It's really never too early or too late to start taking care of yourself. You become advocates for your health. You become health heroes, and that really is critical in taking control of your life. We know cardiac disease is the number one killer, but I leave you with this fact that 80% of these cases can be prevented. And we're talking about February being American Heart Month, Heart Health Month, and how to prevent heart disease. But really, it's every day, every month. And if we can do our part, right? If we can do our part, really advocate for ourselves and your loved ones. It's not just, it may not be you who's smoking, but it may be your spouse, it may be your uncle, your aunt, your loved one, your friend, and you have to remember that we can all do this together, because if we put our heads together and our hearts and minds, we can really change the equation and not have cardiac disease be the number one killer in the U.S. So February is the time. Take action right now.